Okay, I'm recording this video or whatever about my urodynamics procedure because before I was going to have it, it was terrifying me, and I Googled it to find out more about it. And the YouTube videos that were available, or at least that I found with my limited technological skills, were either from medical professionals who are going to tell you what's going on, but have they had it done? Or somebody that was absolutely terrified of and freaking me out because she was just like losing it. And that was her experience, but I wanted to let people see maybe a calmer approach or version of what happened. I had my thing done yesterday. They scheduled me like 1 o'clock or something, 12:30, 1 o'clock. I made sure my bladder was full because I did start to have the procedure before, and they got started on it, and I had a UTI. So if you have the least bit of concern that you might have a UTI, don't go in there and get it all started and then find out you've got to stop, because that's horrible. Call your doctor so you can get on some antibiotics, and it's better to put it off for a week or two and then do it. But anyway, I wore, you want to wear something easy to take off because they're going to ask you to remove the lower half of your clothes. You can keep your socks on. I wore a long sleeve kind of knit top, excuse me, because those rooms that they do tests in and stuff are always so cool. Anyway, and I tried to make really sure that I had my bladder was completely full, as full as it could be, because the first time when they had to stop it, I wasn't able to go when they said, and I thought my bladder was full, but I just froze up or something. I don't know what. But anyway, make sure your bladder's full. Okay, there's a chair, and I was going to do a drawing of it. Unlike, it's kind of like something you would see in, I don't even know. I can't even describe it. It's like if you took a chair and you cut out almost the entire seat of the chair and had this little lip around there, just barely enough to sit your booty on and have your legs on, except it causes your legs to spread out. And underneath that chair is a bucket. That's all, what can I say? I mean, I think they're called birthing chairs. I think that's what somebody described it. Anyway, there's a lot of stuff all over the place. They want you to remove your lower half of your clothes and sit in this chair. And that you have a little cloth to put over you, like when you go to the gynecologist. In my case, there was the girl that was doing the procedure, which is, I guess she's a doctor. I don't know. I'm guessing a doctor. The nurse that was helping her, and lucky me, I had a student there, because it's Vanderbilt and it's a learning hospital, a male student there who was positioned directly in front of me in all my glory. His chair was sitting right in front of me. So I'm like, I got my sheet and I'm holding it down, in front of my crotch area. But he realized, I think, and very, very considerately moved his chair over to the side. So I appreciate that. So when you sit in that chair, the first thing they do is, and I don't remember if they hooked me up with stuff yet or not. I don't remember they'd hooked me up with, but they do ask you to pee. And so they'll step out of the room and they ask you to pee. So go ahead and let it go, because this is the least of it. Go ahead and pee all you want. And then they come back in and they measure that or whatever, everything's being measured. And then they start putting things in you all over the place and attaching things to you. So wires are everywhere. But one of the things that I had read was that you need to shave yourself down there as much as you can because they're going to have tape and stuff down there. So I don't know that it's necessary to absolutely make yourself look like a baby, although I did my best. I was trying my best to because I didn't know how clean they wanted it. But I'd say that just, groom yourself a little bit, make it easier for them and whatever's comfortable for you. But where they put one or two things up the vaginal area, and then they put a probe thing up my booty hole, which that wasn't as uncomfortable as the other stuff. The other stuff was a lot more. That just felt weird, kind of weird. And then everything that they've got up there, they tape it to you, and then there was some kind of thing, little I don't know, measures or something that they put on each side of my booty cheeks, right next to my booty hole. I'm not sure what that was, but anyway, she was explaining everything to me, which I like that. Some people may not, but I like that. But she really wasn't explaining it to me as much as she was explaining it. She was teaching this young guy what she was doing for his future, knowledge or whatever. So let's see. Then they have you. She does this thing where she almost like catheterizes you, puts this thing up in you, and then she brings it back out. Now that's not comfortable, but it's not as painful as you think it's going to be. There's a little it's kind of a pinchy feeling. I don't know how to explain it, but it's uncomfortable, but it's not yell out pain kind of thing, if that makes any sense. And that's measuring something when she does that, bringing it in and out slowly. And then I don't know if I have all this in the right order. I should have done this immediately afterwards, but I was just tired. At some point, after she's done all that, they tell you they're going to start filling your bladder up. Now, this is a weird feeling. They tell you ahead of time it's going to have a cool feeling, and that's exactly what it feels like. It feels just like somebody's pointed a fan at your crotch. You just feel this cool sensation, and they're putting sterile water up into your bladder, and they tell you they're going to start filling you up, and you're to let them know if you feel like you've got to pee. And the first time you feel like you've got to pee, you tell them, and she stops. And then she has you do, what do you call those, kegels? The things to keep you from peeing. She tries to get you to do that, to stop yourself from feeling like you have to pee. And you sit there and you do that until you feel like you don't need to pee anymore. So then, as soon as you feel like you don't have to pee anymore, they start putting more in, and they slowly but surely are trying to fill you up. So I had to stop, I don't know, 4 or 5 times, and I was really good at stopping it, which I'm not good at stopping it when I'm not sitting in that weird chair, but I was decent about stopping it there. So I felt like I was being, just very cooperative. But it was getting harder and harder because it was getting more and more full. And she was telling them all these measurements and all this kind of stuff at the same time as all this was happening. But it got to where it was almost the minute they would start filling up again, I would need to stop. And so when it got to that point, I don't remember how much I got. I think I got half filled, or I don't know how much it was, but she said that was good enough and she could stop it. And so then once they did that, she had I got to pee. They all left the room and I got to pee, and that was really easy, really easy. And then they saw after I peed, they measured that, and then they catheterized me again, and then they measured how much was left inside that I wasn't able to pee out for whatever reason. And even though I felt like I had, then after that they did a lot of this measuring with all that stuff up in you. They did this stuff where she would say push as hard as you can, push, 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 push. Honestly, it's like when you're giving birth and they're telling you to push, 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 push the baby out. That's exactly what it's like, and you are pushing as hard as you can. And I don't know how many times I did that, and then she would tell us to stop. And I think that I don't remember what they did. I think that's about all they did. Because I remember her saying that we're almost through, and I was just so grateful. I was just grateful when I got all that stuff out of me. But that was about all. Then they have you. Then they basically just tell you. I think they've got a lot of. You're covered in down there. You've got betadine, and they've done some. They put all the probes in with lidocaine. Vaseline or lidocaine. A lot of lube. And then they let you go to the bathroom and clean yourself up. And then you can get your clothes on. And in my case, I went to have an exam after that, because right across the hall, I went across the hall and saw the doctor that's going to be doing my surgery. And I had not met her yet because I was so upset after my last procedure that had to be stopped because of my having a UTI. I changed doctors right in the middle of it. I was not happy with the communication between the doctor I was seeing, so I changed to one of his associates, who's a female, who I felt like I could communicate with better. So anyway, I hadn't met her yet, so we talked, and she had to do an exam. And that guy was in there again. That student was in there. And she said, "Do you mind if he's here?" And I said, "No, I think by this time he's seen more of me than I've seen of me. So it really doesn't matter to me anymore." But she was very nice and did a lot of the same kind of pushing and all this kind of stuff that I had done before. But the main thing to know is that the thought of it is much worse than the actual thing. But yes, it's very embarrassing. It's very embarrassing, and very it's just embarrassing. I mean, I don't know any other way to put it. But you just got, if you resign yourself to that, it's going to be embarrassing. You're going to, you're going to be out there and being viewed by 100 million people. If you feel like it's 100, like you're on display for everybody. But I mean, giving birth's not much different. It's a different process, but it's just, I don't know. The thought of it is horrible. And yes, it is embarrassing, but it's just something, just get it over with. I tell you what, honestly, truly, the after, because now it's my second day, and I'm finally, my peeing has gotten under control somewhat. But you talk about, when you have a urinary tract infection and it burns. Jeez Louise. I mean, I've had to wear diapers from time to time. Ugh, I hate even saying that. But fortunately, I had some of those. What Depends or whatever you call them. Because last night I was up and down all night long because I could not make it to the toilet in time. And every time I go, it hurt like the dickens. And today, I did go to work today because I felt fine other than that. And I went to work with all kinds of extra underwear and even a whole complete change of clothes because last night I went through 4 or 5 Depends. I felt like a little baby that had gotten their diaper wet. It was embarrassing. Plus the fact that it hurt. I mean, it felt like a really, really severe UTI. So that was way worse, has been way worse than the actual doing it. So, and I don't know that everybody would be the same way. I mean, who's to say? That was what happened to me, and that was my experience. So, and then the last few times I've gone to the bathroom, I've noticed blood, and they told me about that. I thought it would be before that, but but the incontinence or whatever has gotten a lot better, and I've made it to the bathroom today, so I'm sure each day will get better, and they said that it would. So anyway, that's my experience, and I hope that this. I've never done a YouTube thing before. I've never, and I don't know how many people will see this, but I hope it helps a few people. I wish that I'd had somebody, a real person that wasn't freaking out about it, explain as much detail as they could so that I wouldn't feel like I'm freaking out about it. I'm just glad it's over with, but that's what they have to do to get an accurate idea of what kind of surgery is going to help, or if there's other alternatives. So, good luck with yours, and don't stay up all night worrying about it. That's what I did. It's ridiculous. They are as nice as they can be. The people that are doing it know how embarrassed you are, and they do it all day long. And I know that's what everybody told me, but it's true. And they've seen more crotches than you ever see in your lifetime. They don't probably. It's just like when I used to work on mouths all the time. They all look the same, I guess. I don't know. I don't know. Mine's special. I don't know about yours, but mine is special because it's mine. But anyway, so that's it. Hopefully everything goes well, and you have, as I think, a fairly easy experience as I had. Okay, bye.